Dear students, welcome back. Now we are going to see the anterior abdominal wall, and this anterior abdominal wall is one section of the abdominal wall. So this overall abdominal wall surrounds the abdominal cavity and it is providing some flexible coverage and protecting the internal organs from damage. Normally this abdominal wall is bounded superiorly by the xiphoid process and the costal margins, posteriorly by the vertebral column and inferiorly by the pelvic bones and the inguinal ligament. Actually this inguinal ligament extending from anterior superior iliac spine to the pubis. Okay, so this abdominal wall can be divided into two sections. One is the anterior abdominal wall. Normally this anterior abdominal wall exactly we have to describe as anterolateral. So this anterior abdominal wall covers both anterior side as well as the lateral sides. So it is going to cover anterior side as well as the lateral side. Okay, and the next section is the posterior abdominal wall. So this entire complex structure consists of numerous layers, and this numerous layers from superficial to deep, it consists of skin more superficial, and then superficial fascia. Next one is the superficial fascia, and after that it is having muscles. Okay, it is having muscles, and then with their respective fascia again it is having some fascia, and finally it is having the peritoneum. Normally the layer which is nearer to this fascia, that is extraperitoneal fat is present in this layer. So to that layer the parietal peritoneum is placed after the layer of this extraperitoneal fat. Okay, so these are the layers of the abdomen all over, either anterior as well as the posterior abdominal wall. So before understanding this abdominal wall in detail, you should know the landmarks of this abdomen. Okay, now we are going to see the landmarks of the abdomen. So there are different kinds of landmarks which are used to identify the regions of the abdomen because of this landmarks. So the first one is the anterior median plane. In the anterior median plane, that is, this is the anterior median plane, the abdominal wall extends. So this is the extension of the abdominal wall. In the anterior median plane, the abdominal wall extends from the xiphoid process. Here you can find the xiphoid process, which lies at the level of 9th thoracic vertebra. So the xiphoid process lies at T9, that is 9th thoracic vertebra, to the pubic symphysis. So this is the pubic symphysis, which lies at the level of coccyx. So which is lies at the level of coccyx. Okay, this is the extension in the anterior median plane of the abdominal wall. Okay, coming to the posteriorly as well as the laterally. So this abdominal wall extends. The vertical extent of the abdominal wall is much less as it is replaced by the thoracic cage above and behind and by the gluteal region on the posterior aspect of the lower part. That means, so the extent of the abdominal wall in the anterior aspect is more when compared to the extent of abdominal wall laterally as well as the posteriorly. Okay, so why this vertical extent is less? Because posteriorly and the laterally this abdominal wall is replaced by the thoracic cage. So if you can see, posteriorly this thoracic cage is present and the laterally also you'll have this thoracic cage, but anteriorly the thoracic cage is not present because of this costal margins you can see here. So anteriorly the thoracic cage is not covered up to this levels of L2 or L3. Okay, so for that reason, that space which are occupied on the anterior aspect is not seen on the posterior and lateral aspects. Above it is covered by this thoracic cage, whereas at the lower part on the posterior aspect you'll have the gluteal region. So that gluteal region also occupies some part of this posterior abdomen. Okay, so this is the vertical extent of the abdomen. And next, coming to the superolateral margins of the anterior abdominal wall. Now we are going to deal only with the superolateral margins of the anterior abdominal wall. So the superolateral anterior abdominal walls are formed by this one is right and left costal margins. So these are formed by right and left costal margins. Each margin is formed by the 7th, so that is, this one is 7th, 8th, 9th and 10th costal cartilages. So the costal margins are formed by the 7th, 8th, 9th and 10th costal cartilages. The costal margin reaches its lowest level in the mid-axillary line. So this forms the mid-axillary line here. That is the tip of the 10th costal cartilage. So a mid-axillary line, if you draw like this, so it will come here. So the margin, the costal margin reaches, so this costal margin reaches the lowest level in the mid-axillary line. The margin is formed by the 10th costal cartilage. So these are the superolateral margins. And next landmark is the subcostal plane. So the subcostal plane is the transverse plane passing through the lowest part of the costal margin is called as the subcostal plane. So here you can see this. It passes through the third lumbar vertebrae. Here this one is the third lumbar vertebrae here. So this one is the third lumbar vertebrae. You can see the line below this costal margins, below the 10th costal cartilage. This forms the subcostal plane. This is the transverse plane passing through the lowest part of the costal margin is called the subcostal plane. It passes through the third lumbar vertebra. Okay. Now the another one is infrasternal or subcostal angle. So next one is the infrasternal and the subcostal angle. So here it forms the subcostal angle or infrasternal angle. So infrasternal, infra means below the sternum, it is making an angle that is called as infrasternal angle, and this is formed between the right and left costal margins. The xiphoid process lies in a depression at the apex of the infrasternal angle, and it is present at the level of again the 9th thoracic vertebrae. So now we have seen this anterior median plane extension of the anterior abdominal wall, posterior and lateral extensions, and also we have seen the superior lateral margins of the anterior abdominal wall, and then we have seen the subcostal plane, and another landmark is the infrasternal or subcostal angle. Next one is the Iliac Crest. So these are called as the Iliac Crests. This Iliac Crest forms the lower limit of the abdominal wall at the side. So the Iliac Crest forms the lower limit of the abdominal wall on the sides. The highest point of the Iliac Crest lies at the level of 4th lumbar vertebra. So if you can draw, this is the highest point of Iliac Crest. This lies at the L4 vertebra. So the highest point of the Iliac Crest lies at the level of 4th lumbar vertebra, slightly below the normal level of umbilicus. So here you can find this umbilicus, so which is present in between L3 and L4 level. So this is the umbilicus region. So this line is present normally below the level of normal level of umbilicus. Okay, and this anterior superior iliac spines lie at the level of the sacral promontory. So this one forms the sacral promontory. If you draw a line of anterior superior iliac spines, this forms it is forming the line which is present at the level of the sacral promontory. So this one is oblique. The pelvis is normally placed in oblique. Then you can find the straight line, the level. Okay. Next, the tubercle of the iliac crest is situated on the outer lip of iliac crest, about 5 centimeters behind the anterior superior iliac spine. At this, the intertubercular plane passes through the tubercles. So here you can find, this is very important plane, that is called intertubercular plane. What is that? Intertubercular plane. So this intertubercular plane is formed by the tubercle of the iliac crest, which is, here you can find this tubercle of iliac crest, which is situated 5 centimeters behind the anterior superior iliac spine, and this plane passes through the tubercles. So this passes through the tubercles, and it lies through the 5th lumbar vertebra. So the transtubercular plane lies at the L5 lumbar vertebrae. So now we have seen 2 planes. One is the subcostal plane and the transtubercular plane. And the next one is the inguinal ligament. This inguinal ligament extends from the anterior superior iliac spine to the pubic tubercle. Here you can have this pubic tubercle, so it is extending like this. So this is the inguinal ligament. Okay, it is convex downwards. So this ligament is convex downwards, like you can find this ligament like this. It is convex downwards. Okay, it is convex downwards, and it is placed at the junction of the anterior abdominal wall with the front of the thigh. So it is forming the junction between the anterior abdominal wall with the front of the thigh. So here you can see this is the thigh region. So this from up to here, this is the thigh region. It comes under lower limb. So this ligament forms the junction between the abdomen and the front of the thigh region. Okay. Next one is the Spermatic Cord. You can see in the another pic for this thing. Yes. So here you can also, in this pic, you can also clearly see in this umbilicus region, and also here infrasternal angle here, and this inguinal ligament. Okay, and the next one is the spermatic cord. The spermatic cord is a soft rounded cord present in the male. It can be felt through the skin as it passes downwards near the medial end of the inguinal ligament to enter into the scrotum. So this is the thing. Okay, this is the spermatic cord. Okay, now it can be picked up between the finger and the thumb. When palpated in this way, if you can palpate it at this area, a firm cord-like structure can be felt within the posterior part of the spermatic cord. This is the ductus deferens. This is called as ductus deferens. And also the next one is the anterior abdominal wall is divided into right and left halves by a vertical groove. So here you can see this a vertical groove which is extending from the xiphoid process over this pubic symphysis, that is called as linea alba. Okay, it is called as linea alba. So the anterior abdominal wall is divided into right and left halves by a vertical groove called as linea alba. Next, a little below the middle of the median furrow, there is an irregular depressed or elevated area that is called as umbilicus. So it is present just middle of this line. So below this, so it is not exactly present at the middle of this median plane, but it is present somewhat below the middle of this median groove. There is an irregular depressed or elevated area called as umbilicus, commonly called as navel. It lies at the level of the junction between the third and fourth lumbar vertebrae. Okay, a few centimeters lateral to this median furrow, the abdominal wall shows a curved vertical groove. So these are the curved vertical grooves. So some centimeters lateral to this median furrow, it shows another vertical grooves. Its upper end reaches the costal margin at the tip of the ninth costal cartilage. So this one is the ninth costal cartilage. It reaches the tip of the ninth costal cartilage, and inferiorly it reaches to the pubic tubercles. So this one is the pubic tubercles. Here it is reaching the pubic tubercles, and this is called as linea semi-lunaris. So these are called as linea semi-lunaris. It corresponds to the lateral margin of a muscle called as rectus abdominis muscle. This is the anterior abdominal wall muscle that is called as rectus abdominis muscle. This rectus abdominis muscle, the lateral borders of this muscle represents this linea semi-lunaris. Okay. Next one is the another important plane that is called as transpyloric plane. What is the next one? Another one is the transpyloric. It is an imaginary line, or it is an imaginary transverse plane, oftenly referred as. Anteriorly, it passes through the tips of the 9th costal cartilages. So again, this is the tip of 9th costal cartilage. So the transverse plane, which is passing the tips of the 9th costal cartilages. Okay. And posteriorly through the lower part of the first lumbar vertebrae. So if you can see, it represents posteriorly, this line represents posteriorly at the level of lower border of the L1 vertebra. Okay, first lumbar vertebrae. This plane lies midway between the suprasternal notch and the pubic symphysis. So we know that suprasternal notch, isn't it? Suprasternal notch above this sternum, we are having this suprasternal notch. So if you draw a line here from suprasternal notch to pubic symphysis, it is present exactly at the middle of these two things. Which one? Transpyloric plane. Okay. So this plane lies midway between the suprasternal notch and the pubic symphysis. It is roughly a hand breadth below the Xiphisternal joint. That means below this Xiphisternal joint, a hand breadth. That means the breadth of the hand forms the distance between from Xiphisternal joint to this plane. Okay, from here to here it forms the breadth of the hand. Okay, and next one is, and this plane also represents some of the structures of the abdomen related to this plane. Normally this plane passes through the pylorus of stomach, that is opening of a stomach, hilum of the kidneys, fundus of gallbladder, neck of pancreas, origin of celiac axis, and superior mesenteric arteries. So this line passes through this abdominal archons that we are going to study in detail when we are dealing with this archons. Okay, next, the angle between the last rib and the outer border of the erector spinae. This erector spinae muscle is present on the posterior aspect, which also covers some of the lateral aspect of the thoracic cage and also the abdomen. So the angle between the last rib, that is the 12th rib, and the erector spinae is known as renal angle. So this is the 12th rib. So this 12th rib may only be just palpable lateral to the erector spinae or may extend from distance beyond it. Okay, the 12th, this renal angle represents the lower part of the kidney. So it represents the lower part of the kidney. That is the importance of renal angle. The angle formed between the last rib and the outer border of the erector spine is known as renal angle. So it represents the lower part of the kidney. Next one is the posterior superior iliac spine. So normally the posterior superior iliac spine is present on the posterior aspect. Okay, it lies about 4 centimeters lateral to the median plane. So if you draw a median plane, it lies 4 centimeters to the medial plane. That is the level of posterior superior iliac spine. And 3 transverse furrows may be seen crossing the upper part of the rectus abdominis, corresponding to the tendinous intersections of this muscle. So that means I have told that the anterior abdominal muscle, that is the rectus abdominal muscles, normally we will call this muscle as six-pack muscles, and it is having some sections like transverse furrows may be seen crossing the upper part of the rectus abdominis, corresponding the tendinous intersections of the muscle, that we are going to see in detail in the origin and insertion of this rectus abdominis muscle. Normally one tendinous intersection lies opposite to the umbilicus. So one is present opposite to the umbilicus, okay, and another one is opposite free end of the xiphoid process. Another one, you can see the free end of the xiphoid process. The third is midway between these two. So another one midway between these two. So these intersections we are going to see only in the upper part of the rectus abdominis muscle. So all these are the landmarks of the abdomen. In the next session we are going to see the layers of the abdomen. In that we are going to see the skin, superficial fascia, and the muscles, extraperitoneal fat, and finally we are going to see the peritoneum. Okay, so this is about the landmarks of abdomen. Thank you.